Okay, go ahead, break.
Okay, so we're doing thoracic manipulations today. We're going to do the first five. I mailed out this sheet, outlining all of them, 1 through 20. And then Nan made a nicer, more neat copy of the same. So if you're using mine, the strategy is going to be at the very bottom of the page. Hers is on the second page. Okay, and then if you're using your textbook for reference, it's going to be page 216, figure 5, 174 for this first manipulation. Okay, so strategy. Okay, so the first thing that you're going to do whenever you have to do a manipulation, you're going to convert the restriction over to the malposition. So again, this requires you to know the static listings on page 48 that we had talked about. Okay, so whatever your restriction is, you're going to convert that over to the malposition. So it's going to be exactly opposite of whatever the restriction was. So with the example of this first one, flexion restriction, then what's going to be the malposition? Extension malposition. Okay, so extension malposition. So when you're looking at the spine here, right, an extension malposition means that it's going to be one of these vertebrae, whichever the one that's involved here. Usually you're going to look at a motor unit, which is going to be two vertebrae, and the intervening disc in between is a motor unit. Okay, but here we're talking about the superior vertebrae of that particular motor unit, and on here it's T8 and 9. So you'd have to locate on your patient, where T8 is. How would you do that? With the stuff that you know already. Inferior scapula to T7, I think would be easier. Palpate down to the next spinous process and you're right there. Okay, so that means that T8 is going to be in an extension malposition. So what's extension is when you move back, right? So that particular vertebrae is going to be malaligned in extension like this. Okay, so the object of the whole thing is you're going to want to correct that, right? We correct misalignments or malpositions. So we're going to correct that particular one of the T8 extension by pushing it into flexion, right? You push it in the opposite direction. So again, just so you know, so you take this T8, this is 7, 8, and then it's an extension malposition here. Okay, then from there, you might not have these props available to you, so like an examination, so you should be able to visualize that, Or if you have trouble visualizing it, then you can draw it also. Okay, and then so you could use like I would say even like index cards or something like this, and then just draw a vertebrae. We're looking at it from the side, and draw it in an extension kind of a position. And it doesn't have to be anything fancy. It could be as simple as this. So here's our reference one below, and then you just draw it in extension like this. Okay? And we're going to do this with some of the other ones. This is easy looking at it from the side. When we do the rotational malpositions or the lateral flexion malpositions, then we're going to be looking at it from the back and drawing our simple pictures this way. Okay? So I'm just showing you some things in case you have trouble with this at all. All right. So then you're going to use the name of your technique. Right? This is all different from like how I used to, or how I learned it back in the day. They had different kinds of names for things. And then and it didn't necessarily have to do exactly with, the contact point and the segmental contact point and those kind of things for the names of the techniques. And there's so many different techniques in chiropractic. This is nice though, how you guys have it, because it basically tells you what you need to do to do the manipulation. So you're going to set up the patient in a way to correct that particular malposition. And then you have everything in the name that lets you know how to do this. Okay? It tells you how the patient should be. Right? It tells you how many hands that you're gonna use. It tells you what your segmental contact point, it tells you what your contact point is. And I was gonna ask you about that, if that's what you guys call it here. Your contact point, which would be on the doctor's hand, right? Is that what you guys call the contact point?
Yes.
And then the segmental contact point, it also tells you, what, so like transverse would be the transverse processes, right? And the segmental contact, yeah, so that it would be like a segmental contact point. Oh, the contact point would be like thenar, hypothenar, right? We used to call it back in the day the these would be like modified, diversified piezoform and things like this, but they don't call it that anymore. But they call it hypothenar. But with a hypothenar, you're going to use like the proximal portion of the hypothenar, which is going to be where your piezoform is. Because you get most best thrust when you utilize that particular area. If you go up to distal, when you do this, you could damage your own wrists, right? Because your hands are going to, your wrists are going to bend, and it's going to put unnecessary strength on your own joints. And you're not going to get the force that you need to move the person's bone, especially if it's a large person. Okay? All right. But anyway, so you got prone. It tells you how many hands that you're going to use. It tells you what your contact point is, hypothenar, thenar, whatever. And then it tells you the type of move that you're going to do too. Your line of, we used to call it line of thrust, right? Or they have it here as a vector. Okay, so the vector.
Line of drive.
Line of drive, that's what it was. Yeah, line of drive or vector. We used to call it line of drive. And so you can figure out vectors too if you want to with little arrows. We used to have to do this in physics back in the day. So if you had physics before, understanding vectors, and you'll see with multiple listings, or multiple male alignment, I can't even tell. Multiple male alignments, sometimes you're going to have multiple vectors or directions that you need to move the vertebrae in order to correct it. And all you do is you go right in between the vectors that you created, and that would be the sum of the vectors, right, in physics. Right? Because you're not going to adjust one thing one way, the vertebrae one way, and then turn around and adjust that same vertebrae and the other vector that needs to be corrected. You do it all at the same time. So that's why you take the sum of the vectors. It sounds complicated, but it's just all common sense anyways. Okay. So, our first move is going to be flexion restriction. So what malposition is flexion restriction going to be?
Extension
like we
malposition.
just said. So you visualize this extension malposition. Okay? And then you're going to set up your patient in according to the listing. Okay, so let's set up all the tables, let's divide into doctors and patients, and we're going to do this.
Are you doing how am I gonna do this?
I have a question.
No question, Dory.
How am I gonna do this?
There was one alignment I saw in this book, and I wonder if you ever done it.
We can set it up.
I'm dying right now.
That was one in this book where I was like, this is really